Hey everyone, Dr. T for FocusKIDS, and this is our more detailed version of our FocusKIDS QuickTip on gastroesophageal reflux. If you watch the other one, this is a longer, more detailed version of the QuickTip, so it's coming up right after the intro. So your baby is born, you're all excited, you get her home and she's spitting up all over the place. This is one of the most common questions and concerns I get from parents. My baby is puking all the time, and oftentimes parents are concerned that it's everything and they're worried something is seriously wrong with their brand new bundle of joy. So today we're talking about gastroesophageal reflux, baby style. What's normal, why it's normal for babies to spit up, what's not normal, and if it's not normal, what are we going to do about it? Normal infant reflux or physiologic reflux is called gastroesophageal reflux or GER, while abnormal infant reflux or pathologic reflux is called gastroesophageal reflux disease or GERD. So when is spitting up in babies normal? If your baby is spitting up and feeding well and gaining weight well, meeting her growth and developmental milestones, and when she spits up it just kind of rolls out of her mouth and she's still happy and playing, it's probably normal infant spit up. And as I said earlier, parents will often tell me that it's pretty much everything that they're taking in. When I ask parents to demonstrate how much their baby is spitting up, it's almost always no bigger than the size of a softball or grapefruit. It's rarely much more than that, but that still looks like a lot. But I promise you, it's not as much as you think it is. I've actually taken some formula and poured it out on a large burp cloth. And about an ounce of formula spreads out to about a foot in diameter. So the point there is it's really almost never as much as you think it is. So why do babies have reflux or spit up? It really has to do with immaturity of her nervous system and a small muscle in the GI tract called the lower esophageal sphincter, or the LES, that normally prevents reflux from happening. The LES is at the bottom of the feeding tube, the esophagus, and opens or relaxes to allow food to pass from the esophagus into the stomach. Relaxation of this muscle is controlled by a nerve called the vagus nerve. When we swallow, that sends a signal to the brain that tells the vagus nerve to relax the lower esophageal sphincter, allowing it to open and allowing food to enter your stomach. After you finish swallowing, the LES closes, which is controlled by a nerve called the phrenic nerve, preventing reflux from the stomach back into the esophagus. In babies, the entire nervous system is immature. That's why babies have jerky movements, and that's why they're uncoordinated, and that's why they need to grow and develop. So in babies, like I said, the entire nervous system is immature, including those nerves and muscles that are involved in feeding and preventing reflux. So sometimes in babies, the lower esophageal sphincter relaxes when it's not supposed to. This is really normal in infants, and almost all babies have some reflux, though not all babies spit up. The vast majority of babies with reflux outgrow it by about 12 months to 18 months of age. Changing formulas does not help reflux unless there is concern for a true milk protein allergy. But again, for normal infant reflux, changing formulas doesn't help and is generally discouraged. Thickening feeds with things like rice cereal generally doesn't help much with normal reflux either, but it can be beneficial in some babies under certain circumstances, and I'll talk about that in a bit. So when do we worry that reflux is not normal? Now, although normal weight gain is one of the most sensitive signs of overall good health in an infant, we're not going to just stop with that and say it's normal reflux. We're going to ask more questions to see if your baby is having signs or symptoms that her reflux is not normal and more worrisome. So what are some things we worry about? As I said before, weight gain in infants is critical. So poor weight gain or weight loss in an infant is obviously concerning, and not just for reflux. It can be concerning for a host of other things as well. We also get concerned if there's apparent pain after feeding that might indicate acid is refluxing back into the esophagus. Significant choking or respiratory symptoms after feeding, color change, specifically babies that are turning blue during or after feeding, or projectile vomiting. And by projectile vomiting, I mean it's exorcist shooting across the room projectile vomiting. So if it turns out not to be normal, what are we going to do from there? Your pediatrician may first attempt some conservative treatments like reflux precautions, such as keeping your baby upright for 20 to 30 minutes after each feed, preferably by holding them, as this will help keep them calm, and keeping your baby calm will also help with reflux. If these conservative measures don't work, we may recommend thickening your feeds if she's not gaining weight very well, or we may recommend a trial of an H2 blocker such as Pepcid. If that doesn't work, they may go to a PPI, a proton pump inhibitor such as omeprazole. Your pediatrician may also want some imaging studies, such as an upper GI or a swallow study, and there are a host of other imaging studies as well. Or they may just refer your baby on to a GI specialist. Now, I did mention projectile vomiting. Why is projectile vomiting such a big deal and so worrisome? There's something called pyloric stenosis. The pyloric sphincter, which is a small band of muscle at the bottom of the stomach, it leads to the small intestine. The small intestine is where vitamins and nutrients are absorbed. Normally, the pyloric sphincter is closed after your stomach has started the process of predigestion with stomach acids, and then the stomach contracts to push the partially digested food into the small intestine. The pyloric sphincter opens up and allows food to leave the stomach and enter the small intestine. What can happen in some babies is that pyloric sphincter over time gradually can thicken over about 3 to 4 weeks to the point to where it can't open at all. If that happens, your baby will start having projectile vomiting. She will not gain weight well, or possibly even lose weight, because nothing or almost nothing is getting out of the stomach into the small intestine. So basically, a baby with pyloric stenosis is starving. Fortunately, this is an easy thing to correct, but it does require surgery. This is a one-time surgery, and once the surgery is done, it's done. Your baby will no longer need any further treatment for pyloric stenosis, and she should start getting the nutrition that she needs and gaining weight well and developing well. Pyloric stenosis generally starts at about 3 to 4 weeks of age, and certainly by 2 months of age, if not 6 weeks of age. If your baby hasn't had pyloric stenosis, she's not going to get it. So, bottom line is, the vast majority of infant reflux is normal, and your baby will outgrow it without the need of lab tests or procedures or any kind of treatment or intervention at all by about 12 to 18 months of age. Changing formulas doesn't help, and it's generally discouraged because most infant reflux is not a formula issue. So in general, be reassured that if your baby is growing and developing well and not having any of those worrisome red flag type symptoms, your baby is probably having normal infant reflux. If your baby is having any of those red flag symptoms, talk to her pediatrician or other primary care provider as soon as possible. And as always, if you have any questions or concerns about your baby, consult your pediatrician or other primary care provider. That's what we're there for. We're always happy to answer questions or address concerns. For Focus Kids, this is Dr. T, and this has been a talk on reflux. Thanks so much for watching. Until the next one, we'll catch you on the flip side, and we are out.